All right, acute chest syndrome. Let's just look at this guy first. And so here we have an endotracheal kind of like tube, and we got our bilateral ill-defined opacities over here. It's kind of hard to see on this photo, but let's look into our question set and see if we can't just diagnose this person. So we know it's going to be sickle cell disease and some complications. And the question is, what complications of sickle cell present with chest pain, shortness of breath, and lung infiltrates? That's essentially what our question stem is going to be getting at here. And we know the treatment is going to be IV fluids, pain management, and antibiotic therapy with ceftriaxone and azithromycin. But what is going on here? And it's something that is called acute chest syndrome, okay? And so that's going to be our answer, is acute chest syndrome. And let's just dive in and explain this. So here we have a presentation of acute chest syndrome. It's a life-threatening complication of what? Sickle cell anemia. It's a vaso-occlusive crisis in which the sickle cell red blood cells will block the blood flow to the lungs, and that leads to inflammation, infection, and pulmonary infarction. So it's one of the most common causes of death in sickle cell. So it's all that vaso-occlusion, the sickle cells and the red blood cells are flowing into the lungs. Diagnostic criteria is going to be your x-ray. You're going to see that pulmonary infiltrate on the x-ray, and also like fever. You might see some chest pain, hypoxia, cough, and our patient has all of those. So what do we give him? IV fluids, pain control, ceftriaxone, azithromycin to cover for what? Strep pneumonia and mycoplasma. Supplemental oxygen is given as well, and maybe you might even need some exchange transfusion if it's super severe. So let's look at the other answers, like community-acquired pneumonia. All right, so community-acquired pneumonia, it can look similar, but in sickle cell with acute symptoms, it's more likely to just be acute, even if there's an infection involved, if they have sickle cell. And this time we do know he has sickle cell, so that should make us think of acute chest more than community-acquired. Pulmonary embolism is rare in teens, and it wouldn't cause fevers or infiltrates. And also there's like no DVTs, so you wouldn't think that. Congestive heart failure, that's not typically seen in young sickle cell patients. You would see like bilateral pulmonary edema and not like a localized infiltrate. Our pleural effusion, this would cause your dullness, but not always an infiltrate or a fever, and there's no mention of fluid on the x-ray. You wouldn't see any of that. So you don't see any of that. All right, well, hopefully this is helpful. If it was, just make sure you think about sickle cell patients with acute chest syndrome and how to treat it with IV fluids, and also pain management is super severe. You wouldn't deny them pain management. If they know they have sickle cell, then you should be like, okay, here you go. And antibiotic therapy, ceftriaxone, and azithromycin. So we'll see you in the next vid. Hopefully this was helpful. If it was, like and subscribe.